What is Botox? Botox refers to the brand Botox Registered that is owned by Elegant Aesthetics, which is the first brand of injection type of botulinum toxin used as a cosmetic procedure to reduce wrinkles. It is now commonly used to refer to all injection types of botulinum toxins. How does Botox work? Botox blocks signals from the nerves to the muscles. The injected muscles can't contract, so that prevents wrinkles and fine lines from forming, so making wrinkles relax and soften and stop the existing ones from getting worse. Where can Botox be used on the face? Botox is most often used on dynamic expression lines like the forehead lines, crow's feet lines, which are lines around the eyes, and frown lines. So Botox won't help with static wrinkles caused by sun damage or gravity. Can Botox be used on muscles around the eyes? Yes, Botox can treat hooded eyes, lift eyelids, and eyebrows. However, it cannot treat the eye circles or puffy eyes. How long is the session? One injection session typically lasts about 5 to 10 minutes. What Botox should I get? The currently available most common types of botulinum toxins are Botox, which is known as Vistabel, Dysport, also known as Azalure, and Xeomin, also known as Bocuture. The main difference between the three is their formulation, which affects the dosages, the spread of the products when injected, and the duration of the results. Now, which one to choose will depends on the specific areas to be treated and the outcome to be achieved. Like what kind of results you want it more visible or more subtle, as well as on the recommendations and expertise of the cosmetic practitioner. Are Botox injections safe? The brands which are FDA and CE approved have proven track records like Dysport, Botox, and Xeomin. So Dysport and Botox are the longest, most established brand for over 15 years, are FDA approved and is overall considered very, very safe. But there's still a risk for minor side effects such as minor pain at injection site, swelling around the eyelids, rash and irritation. And some people at higher dose can get a flu-like symptoms like mild fever, body aches. Are Botox injection painful? Extremely tiny needles, between 30 to 34 G needles, have been used for Botox injections. So these special needles are designed for minimal pain and discomfort. Furthermore, our doctors are well trained in giving proper injection that can make your experience virtually painless. Who is suitable to use Botox? Botox and Dysport are suitable for people who have moderate to severe expression line wrinkles. Who should not use Botox? Botox is not recommended for people who have nerves and muscle disorder, breastfeeding mothers, or women looking to become pregnant soon. Of course, you also should not use Botox if you have infection in the area that is due for injection. How fast does Botox start to work? Over half of users see improvement in moderate to severe frown lines between the brows within 2 to 3 days, and the final effects are seen by the end of 2 to 3 weeks. How long will Botox last? It depends on the dosages used and the body's metabolism. So results last between 3 to 4 months, and as the muscle action slowly returns, the lines and wrinkles will begin to reappear and need to be treated again. However, over time, the lines and wrinkles will appear less severe because as the usage of the muscles are much less, they get smaller and thinner than before. Is there any downtime? No, there is minimal downtime. Some people with sensitive skin can get needle marks or small bruises. Although it is recommended that you avoid lying down for 4 hours or rubbing on the injection area, vigorous exercise and alcohol intake for the first 2 to 3 days. Otherwise, you may proceed with your daily activities. Why can't I drink alcohol before and after the treatment? Well, it's usually recommended to hold off drinking alcohol for at least 24 hours before and after your Botox session. Otherwise, alcohol may increase the risk of bruising or swelling around the treatment area. However, drinking more water instead, as Botox can dehydrate your body and you want to replenish this with water, so it's important to drink more. Can I exercise after the Botox injections? We normally recommend patients to avoid strenuous exercise in the first 48 hours after the injections. Adding any pressure to your face like bending or lying down and face massage could cause the Botox to migrate from where it was injected. However, smiling, frowning, raising our eyebrows without touching the face are actually recommended as it helps Botox to work better. Can Botox cause headache? According to a study in the year 2001, about 1% of patients can experience a mild headache following an injection into the muscles of the forehead. It can last a few hours to a few days. Ironically, although some people can experience a headache, Botox can also be used as a headache treatment or also for migraine. Can Botox make the nose smaller? Botox can sometimes be used to reduce the nasal alaris muscle slightly, although no studies have been done on that. So therefore, we would like to combine it with nose-based fillers and nose thread lift, which can add creating a sharper nose tip, a more defined lift, and a sharper and more defined contour. Can Botox reduce double chin? Botox can relax some of the lower face and neck's depressor muscles, allowing the opposing levator muscles to lift. So it works well to reduce the mild to moderate jowls, drooping lips, and neck lines. Filler can be added on for better effects. Will Botox help acne? Botox can curb oil production, reducing breakouts. However, its main purpose shouldn't be used to treat acne. Instead, use it as a bonus outcome when treating your wrinkles and fine lines. Can Botox be used to reduce necklines? The muscles in the neck and the superficial muscles of the face are connected to one another, so the neck can pull the rest of our facial features forward. Botox can relax the neck muscles, which leads to softer wrinkles, getting rid of the cords and lifts the face. Can Botox calm excessive sweating? Hyperhidrosis. Botox can be injected into the scalp, forehead, and temples, as well as under the palms and soles of the feet to stop excessive sweating in these places for several months. This usage has been approved by the FDA, and I recommend it for people who have tried clinical strength and prescription antiperspirants with no success, and for those people who have significant embarrassment from sweating or need to change clothing during the day because of it. Does Botox contain preservatives? According to FDA, Botox does not contain a preservative against potential contamination of the product through repeated use of a single vial. Once opened and diluted, Botox should be used within 24 hours. Can Botox be reversed? So for some people who do too much Botox on the forehead, the muscles will get thinner and flatter. So they may notice that the forehead muscles look flatter and a little bit concave. So in this scenario, they should actually stop doing Botox and instead of other alternatives for wrinkle reductions, such as putting up fillers to fill up the sunkenness and the thinness of the skin. Or sometimes they can also do HIFU, which can tighten and lift up the forehead muscles.